I have with me Karen Mulligan, the Executive Director of 211. Really happy to have you here this afternoon, Karen. I for 211. I work in the nonprofit sector for almost 20 years now, and I directed clients, friends, colleagues to any sort of information. So, but for those of you viewers out there, the viewers there that don't know about 211 Ontario, you speak to a little bit of Karen?
It's available in English and French, plus we have access to about 150 other languages through a tele-interpreter service. And the purpose of the helpline is to really direct people to where the programs and services exist to meet their needs in a number of areas. And really that's a broad range of services, but everything from healthcare to legal services to food, income tax assistance, just a whole host of programs that are offered by government, but also by community partners like United Way.
Awesome. So during a pandemic like this, like COVID, which we've never experienced before, I imagine it must be taxing even on, the responders on your end. When do people call, and what are people calling about?
Great question. Actually, I mean, it really does fall into about three general categories right now in terms of what we're hearing from people about. The main pressing issues are, as you can imagine, food, income, well, not income, but help them like utility bill to apply for the new federal benefits, and potentially, when all of this is over, retraining opportunities for a different career or possibly just a new job. Many people, as we've heard in the news, up to 1 million people applied in the first day that those benefits were made available. So it's a very trying, and people are also looking for things like mental health resources. So a good number of our referrals are falling into those three broad categories right now.
And I can imagine, because there's so many questions and, there's got to be a lot of fear and panic out there. I can imagine that a service like 211 being available in a community would relieve some stress off of our first responders. Do you have any information to share on that, or?
Absolutely. Yeah, it's a great question again, because we've been working with first responders for quite some time, and whether that's police, paramedics, fire, other emergency management officials in times of disaster, the pressure on the 911 system and emergency resources is pretty intense. And so any of those non-urgent calls that can be redirected to 211 for people to get non-urgent help, that really does take to that is how and when some of the larger natural disasters where really the 911 system was put in incredible amount of strain because of the calls for things like, I'm looking for my mom who was in New Orleans during the flood or something like that. These are calls that really do tie up the emergency system that 211 was able to provide support for. So at this time, we are certainly working with not only those first clearly beyond the immediate physical needs. They also are seeing needs for people who don't have a way to get food because they need to self-isolate or they can't afford to pay for their medications, et cetera. So those are the ones where we're working directly with them to be able to respond to those needs and let them do on the front lines of this health scare.
Great. So I had an interesting conversation with one of your colleagues a couple of weeks back. and they were talking about how in some other cities, 211 is working directly with some of those first responders, so that you can educate people on, when to call on, but B, to almost like a referral
Yes.
basis. Can you elaborate on that?
Sure. Yeah, absolutely. That we refer to that as a closed loop referral, and it is happening with the number of paramedic services across the province, as well as with primary care physicians in certain areas. So the idea being that, again, they identify needs beyond the immediate health needs of that individual. They send a referral through, of course, with permission from the patient, but they send a referral through to 211. 211 then follows up with the patient and assesses their needs for those non-health related services, and then is able to provide information back to the healthcare provider or paramedic about what the outcome of that conversation was. Did they access those services, and feed that information back, actually, in some cases, right into the person's electronic medical record. So,
Sorry.
yeah, go ahead.
Ultimately, there's really no wrong door. We talk about that a lot of times. Like, when
For sure.
people actually reach out for help,
Mhm.
you're finding time and time again, they're having to tell their story over and over and over again. And
Absolutely.
I can imagine a system like this would settle that down.
Absolutely. Yeah. And it is showing really great promise in the early days. And it is very much in a pilot in most communities where it exists, because it is a bit more resource heavy as far as the information that has to flow back and forth between 211 and the health partner. However, we do see it as a model that can be used and really expanded upon in the future, and have that closed loop piece that really focuses on that person's entire health and well-being journey, because there are so many different touch points, and it's hard to get a picture of the whole journey when you're just reporting on one single piece. So,
Right. So, what if somebody were to call and they were in major crisis?
mhm,
Is there going to be a line that can talk to them? Okay.
absolutely.
But then are they just leaving them with the phone number, or what
Mm,
happens in that situation?
sure. Yeah, we have a lot of protocols in place with 911, with crisis lines, with other sort of emergency or crisis type services. So if a person is in immediate crisis, first of all of our 211 navigators are fully trained in assist, which is essentially suicide prevention, and identifying whether that person is in that stage of crisis. We would follow certain protocols, and in some cases do a warm handoff to another agency or distress line. In other cases, again, if it's a child, we absolutely have a duty to report if they're reporting things of a certain nature. Then all of those processes and protocols are in place. But we also work really closely with a number of other agencies like Kids Help Phone, like Connects Ontario, around mental health and addiction.
Crisis. We know that crisis does not follow the 9 to 5. Like, crisis can happen at any time of the day. How can what are 211's hours, and what are other ways that people can connect if you don't want to pick up the phone, let's say?
Absolutely. So we are 24/7. Our phone lines are open 24/7. And the service is delivered by a number of regional partners, and so we work in an integrated system, and all of the calls for our overnight and weekend are answered in one contact center. So we do work very closely across those different regions to share information. But essentially, there are other channels that people can reach out to. As you've indicated, we just launched chat province-wide in February of this year. It is limited hours, so it's only available between 7 a.m. and 9 p.m., Monday to Friday. But we also have an online search at 211ontario.ca, where people can locate, put in their community, select one of the topics, and search for whatever services are available near them. that is often used by a lot of the frontline workers at different agencies, even at food banks and that sort of thing, to be able to refer somebody coming in their doors to another kind of service that they might benefit from. So the online channels are absolutely accessible. There's also an email, gethelp@211ontario.ca, where again call our call navigators can also respond to those emails. And of course, um, it's not instantaneous, but it does also allow for a pretty prompt response, and therefore not sort of waiting on the phone line for what could be, up to half an hour at this point. So
the email is new to me, so thanks. You just
there you go.
So I can imagine with all of these calls now, there's just an enormous amount government and funders, including what calls can't be answered. How can you talk about how this information is accessible to, to the general public, actually? And maybe is it shared with the government? Does the government do it and use it in program design?
Great question. So the data that we collect, we refer to as our needs data as well as unmet needs. So you pointed to, especially at this time, I mean, things are changing so rapidly. Many organizations that used to deliver service, especially in-person services, are having to now turn their operations to more of a virtual service. So essentially what we're doing is collecting not only what are people calling us about, that's what we refer to as needs, but also when somebody calls us for, say, a food program and there isn't something that's immediately available in their area or they can't travel to it, we track that as an unmet need, even though there may be a program. For whatever reason, that person either can't get to it, or if it's a different type of program, they can't afford to pay the fees. So we track that. We track where the person is calling from and some of the demographic data about those callers, and we capture that in a dashboard that we actually make available publicly through our website. So we've set up a new microsite for the purposes of the COVID response, and it's at 211oncovid19.ca. If you scroll to the bottom of that page, there's actually a link that leads you to a dashboard that shows all of the COVID-related contacts, what it was that people were asking about, and again, those unmet needs. And you can break that down at a community level. We are sharing on a regular basis a weekly summary provincial level with our own ministry, which is the Ministry of Children, Community and Social Services. We're also beginning to share questions in addition to some of the other things we've talked about, food and income assistance.
So we have a link on our Get Help page for 211, but we'll certainly add the COVID specific link there. That would be helpful. I'll say, and then finally, as far as nonprofits that are out there, how can they update their information? Because I can imagine at this time, services for all kinds of organizations have either maybe ceased in some cases and changed in others to be able to meet the needs of the state that we're in today.
Yeah, it's a really important issue right now because, as you said, we have about 60,000 programs and services in our provincial database. So those programs and services available in local communities, but also things like provincial helplines and hotlines and services like Service Canada, where you apply for things like the new CERB benefits. So all of those programs at the moment are changing, and we are trying our hardest to keep up with all of those updates, but we are asking agencies to share with us any kind of updates that are relevant to, especially to the priority needs that we've already talked about. Some of the our assumption right now is that any other kind of social programs, gatherings, service, that sort of thing, are just not operating right now, and or they may be doing some things, but it's not a priority issue today. So we're focused on updating the data for those critical services at the moment. We're also working with some of our partners that we're not going back to those same agencies multiple times for the same updates. And more of those conversations are happening because we all have limited resources and are trying to respond to this very urgent need. So the more we can be working with those partners and not duplicating efforts at this time is really key as well.
Absolutely. That's the conversation here at United Way is, we're working very hard to assess the needs of our local agencies, the nonprofits that are doing this work. It's not about, reinventing another solution. Yeah. It's about, really making sure that those agencies have the resources to tackle all of the issues that are in front of us today. So thank you so much, Karen. I really appreciate you coming on.
Yes, it was great to talk to you, Karen.
Thanks, you too. It's nice to have a face-to-face. And thank you all for joining us. Join us here every day at 3 o'clock.